Are you constantly struggling with dry and chapped lips? Well, you're not alone. This is super common and something I struggle with myself as well. So in today's video, I want to dive a little bit deeper into lip care and teach you ways to minimize dry and chapped lips. Hi, my name is Dr. Jenny Liu. I'm a board-certified dermatologist and welcome back to my YouTube channel. Today we're talking all about lip care. So if that sounds good to you, I would love it if you can give this video a thumbs up and hit that subscribe button. So before we dive into lip care, let's talk a little bit about lip anatomy. So the lip is definitely a unique structure on our face. And compared to skin that's present on the rest of our face, it, number one, has a much thinner stratum corneum, so that protective top layer of the skin. And two, it has a faster rate of turnover. So the skin cells renew themselves at a faster rate, which is good. I mean, that's really important because number one, we do a lot with our lips, right? We subject it to eating, there's trauma, we accidentally bite our lips. And so all of that does allow for the lip skin to heal at a faster rate. We also know compared to the rest of the skin on our face or our body, the lips have no hair follicles, no oil glands, and also have less melanocytes, the pigment producing cells. So all this means that the lip is actually more vulnerable to a couple things. Number one, the lack of oil means the lip is more easily prone to dehydration, dryness, and chapped skin. And two, lack of melanocytes makes them more vulnerable to, say, UV damage. And on top of that, there's actually been found that lip skin have lower amounts of ceramides. Ceramides are very important lipids that form that skin barrier. And so all of this together just make the lip skin more vulnerable to damage, UV damage, dryness, thereby getting chapped and cracked. And aside from just dryness and chapped lips, skin cancer is definitely a concern, especially of the lower lip, just because in most people, the lower lip tends to protrude out more and sun tends to hit it more. And the risk of skin cancer is definitely there, and especially higher if you are a smoker or an ex-smoker. And then on top of that, you have seasonal changes like with winter that can just lead to more dehydration of the skin in general. And then lifestyle habits, right? Eating, drinking, certain things we put on our lips, and then obviously lip licking, which can be a culprit for what's called lip licker's dermatitis. This chronic wetting, drying, and then re-wetting of the lip basically just really pulls moisture out of your lip skin, causing it to get more dry, chapped, and cracked. So aside from the lip's inability to retain moisture due to the lack of lipids, there are other things that we could be putting on our lips that are making things worse. Like for example, certain things in chapstick, lipstick, products that we put on our lips, like common allergens, including fragrances, menthol, other preservatives. Toothpaste can also be an irritant, as well as other dental hygiene products. So aside from just dry lips, there could be other medical conditions that could be contributing or causing your dry, chapped lips. So including, as I mentioned earlier, lip licker's dermatitis, where patients will often come in with dry, cracked lips, but also that rash that will kind of extend beyond the borders of where our lips are normally, because from the inflammation due to, again, the chronic lip licking, wetting of the skin, leading to drying of the skin and then re-wetting the skin. And that cycle really perpetuates inflammation and dermatitis. There's another condition called angular cheilitis or perlish, where individuals often will have kind of painful fissures at the corners of the mouth. And that has to do with due to basically the anatomy of the mouth not being able to close very well. We may see this often in people who wear dentures, or individuals as with age may lose support structure around the mouth and saliva would pool, and you can get yeast and bacterial overgrowth that cause inflammation and thereby cracking of the corners of the lip. And then lastly, as I mentioned, allergic or irritant contact dermatitis from things that you're directly putting on your lip that may be also exacerbating your dry and chapped lips. Now, in these instances, whether it's allergic contact dermatitis, irritant dermatitis, lip licker's dermatitis, or angular cheilitis, it is really best treated by seeing a dermatologist, because often for these cases, we need prescription medications to effectively reduce inflammation, treat any underlying infection, as well as may need to undergo certain testing to figure out what products or ingredients that may be causing or persisting the lip rash. Now, if you don't have any of those conditions, but just struggle with dry lips like myself, then here are 3 simple tips that can help to keep your lips moist, hydrated, and less likely to get chapped. Tip number 1 is use a gentle exfoliation. Exfoliation can be helpful, especially for those that have a lot of dry, flaky lip that is just not going away despite how much Aquaphor or like say lip balm you're using. What's happening here is that when our skin gets dry, the enzymes that help with natural skin turnover or natural skin exfoliation is not working properly. That is why you get the retention and the buildup of dead skin. So a gentle exfoliation or gentle exfoliant can really help to remove that dead skin buildup and really prep your lip for proper moisturization that comes after. Now here, when I'm mentioning exfoliation, I'm really referring to chemical exfoliants, not any sort of harsh abrasive lip scrubs, any sort of like using your toothbrush to brush your lips. Those can cause more irritation if your lip is already at baseline dry, cracked, and chapped. And not only can it cause worsening of pre-existing inflammation, if you are prone to lip hyperpigmentation, that irritation can certainly worsen the discoloration of your lip. And so this is where I recommend going with a chemical exfoliant, using it on your lip maybe once a week or so, just like you would for your skin, to kind of gently help to rehydrate your skin, remove dead skin buildup, and may even help with lip discoloration. As far as the formulation, I recommend picking in the form of a toner that you can gently apply to your lip or a chemical exfoliating serum. And I have certainly talked about quite a few of those in my previous video. You can check out my older videos. But in general, I recommend glycolic acid or lactic acid. Glycolic acid ones, the one from L'Oreal's Revitalift 10% glycolic acid serum is a great one. I have one on hand, is from Neutrogena, the Hydro Boost glycolic acid 10% peel. This is fragrance free. And that's the other thing too. When it comes to putting stuff on the lip, I definitely recommend going with fragrance free products if possible, just because we know fragrance can be a risk of irritants on the lip. And if your lip is already dry and chapped, just want to lessen any potential allergens that may be in the product. If glycolic acid is too irritating for you, lactic acid is another great option. Lactic acid is more gentle and is also a great humectant. So many different types of lactic acid serums on the market. One that comes to mind right away is the one from The Ordinary. They're 10% lactic acid with hyaluronic acid. That is a great choice. Now, basically, you would just apply a tiny amount of the serum or put a little few drops of it on a cotton pad and just gently apply it on your lip. A little bit goes a long way. Now, one thing to be mindful of is that if you are prone to getting cold sores on your lip, you definitely want to be very cautious about like how you introduce the chemical exfoliant. And here, going with something like lactic acid or even like polyhydroxy acid may make sense. You definitely want to avoid using a chemical exfoliant on your lip if you have active cold sores, because that's just going to cause more irritation and could potentially lead to more outbreaks. Okay, we have gently exfoliated and prepped our lips. Step 2 is hydration. Now, hydration is something we should be doing on a regular basis every single day, even multiple times throughout the day, to help add moisture back to our lip to prevent it from drying out. Even though the chemical exfoliation only happens a few times a week, this hydration part really happens on a regular basis, and definitely after using a chemical exfoliant. When it comes to hydrating your lips, I really recommend like lip balm, chapstick that contains ingredients like humectants, glycerin, hyaluronic acid, as well as other fatty acids that can help to soften, moist, and add water back to our lips. So one lip balm chapstick that I really like is from La Roche-Posay, the Nutritic lip balm that contains wonderful ingredients to instantly soften and add moisture back to dry lips. Also helps to soothe chapped lips as well, and it's very non-greasy and glides on the lips very easily and very smoothly. It contains wonderful ingredients like ceramides, shea butter, and glycerin that are hydrating, helps to repair the skin barrier. There's also vitamin E that's a great antioxidant, that's anti-inflammatory as well. And this is just a great all-around, really easy to keep in your pocket, put in your bag and to put it on throughout the day as needed to reduce lip dryness and chapped lips. Another one that I think is really great if you have more like wrinkly lips, often seen as with age, and something that can be really helpful if it's more anti-aging concerns, just to plump up the lip so that way it doesn't always look so dry, wrinkly, and chapped. And that is from Paula's Choice. Their hyaluronic acid peptide lip booster. It contains a blend of hyaluronic acids and peptides that can help to hydrate and plump and soften the lip, along with squalane, which is very nourishing. So this is one that's a little more expensive, and I think it kind of is more the little extra in lip care, where it's not just helping to hydrate the lip, but also help to tackle some of the wrinkles and fine lines that we all get on our lip as well with aging. So it definitely is something that can be nice to have in your lip care routine for those that are more bothered by, aside from just the dryness and hydration, the fine lines and wrinkling that develops from just age and sun damage. Now, we can't talk about lip care without at least mentioning one lip UV protectant. There's a lot of different products out there on the market, some that literally is just like a chapstick, some that actually are tinted like makeup. So one that I really like that I think is really suitable for all individuals is one from Ulta MD, their UV lip balm that comes in SPF 36. This is a really nice one because not only does it offer UV protection, it contains chemical filter along with zinc oxide, but also has hyaluronic acid, petrolatum, and then glycerin. So great ingredients to help to hydrate and then lock in the moisture. And it's just really easy one that you can carry, in your purse. When it comes to lip, I feel like I am also guilty of this, but many of us don't think about protecting our lip from sun damage. And aside from skin cancer, aging is a big concern, and often one of the reasons why people seek out lip filler. So if we can get in the habit of properly protecting our lip, or more readily protecting our lip like we do with the rest of our skin, definitely your lips will thank you later on. And also just remember that chronic sun damage does eat away at the volume and cause wrinkling, and that itself can lead to dry and chapped lips. And so certainly lip protection, definitely if you're going to be outside for extended period of time, but yeah, have them just throughout your house in your purse so that way you're more likely to have it around for you to use. So we have gently exfoliated, we have hydrated our lips, and then last step is just occlusive and to seal in all the moisture and prevent transepidermal water loss. And really, there's no product out there that does it better than just plain old petrolatum. Petrolatum is such a great multitasker. I mean, we use it for so many things, but really it's my go-to. Every night before I sleep, I coat my lips in some sort of petrolatum ointment to really help to add long-lasting moisturization, reduce transepidermal water loss. And certainly if you have chronic dry chapped lips and you worry about potentially using lip care products that may be irritating, there's nothing safer than 100% petrolatum. And so this is a great one that only helps to hydrate your skin, adding in long-lasting moisture, but also can protect your lip as well. Like for example, individuals that are prone to getting fissures on the lip or the corners of the mouth, as I mentioned earlier, like angular cheilitis. Using petrolatum, applying it at the corners of our mouth before you eat throughout the day, not only helps to protect the skin from saliva, reducing that irritation, but also encourage the lip skin to heal at a faster rate. As far as product goes, it's really just personal choice. I mean, I kind of just use whatever I have around the house, but I've used from 100% petrolatum to like Aquaphor. Aquaphor also comes in multiple different sizes, which is really nice. You can have a big jar to use on, lips, on body. You can have medium size or smaller ones to keep in your purse. Vaseline, the Vaseline petrolatum, also comes in like a chapstick form that is also convenient to not only use but also to have on the go. There's also CeraVe and Cetaphil healing ointment, although I do find those two to be not as occlusive enough. I honestly, when it comes to lips, I much rather prefer just 100% petrolatum or Aquaphor. I find that these two really add the most long-lasting, occlusive, protective benefits to my lips compared to the other two. The other two I feel like just a little bit more lightweight, so not so much great for the lips based on my personal opinion, but I love it for other places like chapped, flaky skin. on the face, or say like chafing on the underarms. It works really well, but it's not as sticky or heavy. All right, guys, so those are the 3 steps: gently exfoliate, hydrate, and then applying occlusive. Now, by no means should you be doing all 3 steps on a daily basis. These are just tips to really help get you through the times where your lips is extra dry, flaky, and chapped. On a regular basis, what you should be doing, and what I do, is just picking a chapstick or ointment of choice and putting that on your lip daily, and honestly multiple times throughout the day, to keep your lips moist and hydrated. And then if you're having moments where your lips is just extra flaky and chapped, have a lot of like retained dead dry skin, this is where the exfoliation followed by hydration and an occlusive can be extra helpful. Okay, so those are my 3 steps to help rejuvenate dry, flaky, chapped lips. Let me know in the comments below, do you exfoliate your lips? If so, I would love to know what products you use on a regular basis. Thank you so much for watching. I'll see you guys next time.